What's the history of your practice?
So we've been around for over 60 years now. Dr. Beatty was the original optometrist in the practice. We were actually on North Prospect Street. Dr. Archer started with him in 1975, and then I started with Dr. Archer in 2002, and I've been practicing with him ever since.
What have been some advancements within your industry?
So there's three big things that are really, really new in our profession. The first is contact lenses, and contact lenses continue to get more comfortable for people because a lot of times that's the one complaint that people have about contact lenses. And interestingly, for people who need a bifocal, the lenses have gotten a lot better. There's actually a third type of contact lens called a scleral lens that we fit for people who are literally blind. They can't wear glasses or regular contact lenses and see clearly, and we can now make them see clearly again. So those are huge advances. The second place where we look for advances are how do we treat ocular disease and eye health issues, and there have been so many advances there. We have instrumentation now that almost takes an MRI of the eye, so we get views of the eye like we've never had before, and that's available in the office. So if we see something that we need to take a better look at, we can take pictures of it, and we can also take these MRIs of the eyes. And then the third big place where there's been major advances in our profession is with the glasses and the lenses that we use. Now they're thinner, they're lighter than ever, and it's not only just the lenses, but it's the frames as well too, and they're just super, super fashionable now as well.
How old do you need to be for contact lenses?
That's such a good question because we used to think there was actually an age, and age is less important than the maturity of the person that we're fitting. See, so with a child, there's always three things we have to ask ourselves. One, is the surface of the eye, or is the eye health good for contact lenses? The second thing is how motivated is the child for contact lenses? And the third and the most important thing is how responsible do the parents think the child is for contact lenses? And if the child's eyes are healthy, if the child wants to wear contact lenses, and if the parents say, yeah, I think my child is mature enough for contact lenses, then they're perfect candidates for contact lenses. The cool thing for parents as well too is there used to be a lot of concerns about cleaning contact lenses and things like that. You really had to make sure that you kept your contact lenses clean, otherwise you could get eye infections. Well, now there are lenses that you literally wear for a day. You put them on your eyes, and then at the end of the day, when you're done with them, you throw them away. So you never have to worry about a contact lens getting dirty or anything like that. There's even another cool contact lens for kids where you put it on your eye right before you go to sleep at night, and then when you wake up in the morning, you take the contact lens out and you can see clearly. It's called orthokeratology, and it's the newest thing that we have for not only kids but even adults who need glasses to see clearer and better.
Do you offer safety eyewear for young athletes?
Yeah, we do. We actually think it's important to actually have your primary pair and then also a pair that you can perform your athletics within as well too. But what we're finding with a lot of those students is they're actually migrating into contact lenses. Contact lenses are kind of interesting because they give you the freedom to see like everybody else does without needing the glasses. So there's really two ways to do that. One is to provide the child with safety eyewear that they just wear when they're playing sports, or the second option is to actually go with contact lenses for those children.
When should a child have their first eye exam?
This is such a good question, and there's a lot of kind of misperceptions about this. There's actually a program called the Infancy Program where children can get their eyes examined between the ages of 6 months and a year at no cost. Most people kind of think about that and they say, oh my gosh, how can you examine somebody's eyes at that age? Because there's no way that they can answer the question which one's better, one or two. But what we really do is we really do a more comprehensive ocular health assessment, and there are tools that we have in our office and equipment where we can measure the eyes and we can determine if those kids are outside of the normal range. Because one of the things we worry about with infants in particular is that they're at risk for an eye turn, and we want to prevent those things from happening or occurring.
What are some warning signs for parents that a child might need glasses?
So there's several things. The first is a behavioral change in the child. So for example, if a child's always sitting towards the back of the living room when they're watching TV and now they're starting to approach it more, so that's a red flag. The other thing too is if the parents are actually seeing things and asking the child what they think about what they're seeing, and then the child says, well, I don't know, Mom or Dad, I can't really see that. Those are kind of the obvious ones. The ones that are much more subtle are the kids who actually need help with the reading, because oftentimes they don't complain in the traditional ways. Oftentimes they'll have headaches, they'll have eye strain, a lot of things that don't necessarily easily present themselves. One of the things to make sure of is that if your child hasn't had their eyes examined in the last 2 years, make sure that they have, just to make sure that the eyes are in fact healthy and everything's good with them.
How much a part of your practice is educating your patients?
That's such a great question. I still remember being interviewed for optometry school, so before I even started school, and they asked me what I thought about the teaching profession. And really the link there was that healthcare providers need to be, in fact, educators. We don't teach a classroom of people, but we teach patients one-on-one more so about the health of their eyes, the status of their eyes, and how their eyes are focusing. So it's such a great question that you ask me how much of my time and my day is spent educating patients, because virtually all of it is. Whenever we do a test, whenever we measure the eye, whenever we're prescribing anything, it's always an educational process for that patient so that they hopefully understand why those recommendations and those prescription products are being offered and produced, and more importantly, how it helps the eye function better and more normal. So we feel that almost all of our day is just literally educating patients and people how their eyes work and how they work better.
If someone would like an eye exam, what is that process?
That's great. So you can call the office. Our number is 419-352-2502, and you can call in and schedule an appointment. And there you'd either see myself, Dr. Archer, or Dr. Needham, and we'd make sure that we do a full assessment on the eyes. We make sure that we determine how the eyes are focusing, and then we talk about the options in terms of what would be best to actually correct your vision or to help whatever eye problems you may have.
Thank you so much for your time.
Oh, thank you so much for your time as well.
This is Audrina Layfield reporting for the Bowling Green Digital Media Club. Thank you for coming on board as a student sponsor. What are your thoughts on this program?
I think it's phenomenal. I think having the opportunity to do this as a student at your age is just absolutely magnificent. I think the training that you get in front of a camera and the real life interaction here is awesome for you. I think that you'll probably see businesses and professions that you wouldn't have even been exposed to without this opportunity here as well too. We think that this is great, and we personally provide a lot of support in the community, certainly through the practice, and also being a member of the Rotary Club as well too.
What other organizations do you support in this community?
Oh, thanks for asking. So we support a lot of school efforts and initiatives. We've provided eye care for individuals who couldn't afford care and who broke their glasses, who've done other things but have been in situations where they can't afford care. And through the Rotary Club, we just provide so much local charity efforts as well, too. So we're heavily and deeply involved in the community.
Thank you for all you do for the community.
Thank you. Thank you.
Thank you for coming on board as a student sponsor. What are your thoughts on this program?
I think it's a great way to get young people involved with news coverage, and I think it's a great way to turn a spotlight on the local charities.
What other community activities do you support?
I'm on the board for Wood Lane Residential Services, the pre-professional society at Bowling Green State University, and Rotary Club. This organization, Phipps Levin Hebeka, is going to be having our Veterans Charity on Friday. That's our Star Stripes and Smiles Veterans Appreciation Day, and that's Friday, May 4th.
Thank you for all you do for this community.
Thank you.